Hi, hello, good morning, everyone. And today we're going to discuss another topic, which is NGT. NGT means nasogastric tube. And what is nasogastric tubing? This is an intubation via our nasal cannula going to our stomach. And the purpose of nasogastric tubing is for therapeutic purposes and for diagnosis. So come on guys, join me today. Let's get started. What are the indications of nasogastric feeding? First is to those patients who are comatose, those premature infants, those who have frequent aspiration, like with elderly, because they have difficulty in swallowing their food, and those who have just had their surgery or post surgery in the face and on the neck, and those patients who have severe trauma and injuries due to accidents. So, those are indications why we have to insert a nasogastric tube for therapeutic purposes. Are the possible complications of nasogastric tubing? So, first, there will be constipation or diarrhea or dehydration, and also skin lesions around the insertion site, especially in the abdomen. If a person is using a percutaneous endoscopic gastrostomy, and there will be also perforation and peritonitis. So, those are the possible complications when a person is having nasogastric tubing, or not only NGT but also having PEG. And what are the signs of tube feeding intolerance? Constipation, diarrhea, bloating, nausea and vomiting. We have frequent burping and abdominal pain. The first step in giving your NGT feeding is to do hand washing. Wash your hands well with soap and water and dry it carefully with your paper towels. You need the following: the feeding, a cup of water, a 60 ml syringe, your stethoscope. Prop the patient or place the patient in 30 degrees angle. Check the patency of the tube. Introduce 30 cc of air bolus into the tube. Use your stethoscope to hear gurgling sounds. Flask the tube with 30 cc of water. Administer your feeding into the tube. Raise your syringe just above your patient. Watch the flow of your feeding by gravity. Flush again the tube with 30 cc of water. Observe for any signs of feeding intolerance. Place the patient in an upright position. Return all supplies. Perform hand washing. Record the amount of feeding and patient's reaction toward the feeding.